liver is a large reddish-brown glandular organ located in the upper right portion of the abdominal cavity. It secretes bile and performs several important functions. The hepatitis C virus is a blood-borne pathogen and primarily affects the liver. The hepatitis C virus contains RNA, or ribonucleic acid, as the genetic material in its core, which is surrounded by a fatty envelope. The virus enters the body, circulates in the bloodstream, and attaches to liver cells. Once attached, the virus releases the RNA into the healthy cells. The viral RNA then replicates itself hundreds or thousands of times, making genetic material required to produce new viruses. These new viruses in turn infect other liver cells. Eventually, this process shuts down most of the normal functions of the liver cell and damages it. Symptoms of hepatitis: jaundice, mild fever, muscle and joint aches, nausea, vomiting, loss of appetite, abdominal pain. This infection may continue for years, eventually resulting in scarring of the liver tissue, called cirrhosis. Liver cancer can also develop in later stages.
Hepatitis C, a hidden disease that may have no symptoms. Left untreated, hepatitis C can destroy your liver over time, possibly leading to fibrosis, cirrhosis, liver cancer, or death. If you're 50 or older or have a history of drug use, you may be at risk. Talk to your doctor about getting tested. Treatment can cure hepatitis C. To learn if you're at risk, call 311 or visit nyc.gov and search Hep C.
So when HIV buds from a cell, it's not in a mature form. Its proteins are actually in a multi-linked chain. So protease comes in and it cleaves the proteins in several different places. So the proteins undergo a conformational change. And actually HIV becomes mature. And the life cycle goes on. So when protease is inhibited by a medication called ritonavir, in this case it's a protease inhibitor, it binds to the active site in protease. So now it can't cleave the protein. So if it can't cleave the protein, then HIV can't become mature. And the life cycle is inhibited.
Lopinavir and ritonavir is a prescription medication used in combination with other medications to treat HIV infection. It is a combination product that contains two medications, lopinavir, a protease inhibitor, and ritonavir, also a protease inhibitor. This medication comes in tablet, capsule, and oral liquid forms and is taken once or twice daily. The tablet form may be taken with or without food. However, the capsule and liquid form should be taken with food. Common side effects include diarrhea, nausea, and vomiting. Always take this medication only as prescribed. Keep up to date with medication information by following ArtsWiki on your favorite social media platforms.
Number 4. New era in hepatitis C treatment. Hepatitis C infection is a common liver disease that affects an estimated 4 million people in the U.S. The infection is transmitted through exposure to infected blood. 70% of patients with hepatitis C develop chronic disease, and 30% may develop cirrhosis of the liver within 20 years of exposure to the virus. The protease inhibitor advanced drugs, developed in 2011, changed treatment for hepatitis C patients with considerable improvements. Now, the first all-oral hepatitis C treatment is moving through the final stages of FDA approval. This will be the first drug for patients with genotype 2 hepatitis C. Study trial results with the new drug show an increased cure rate to 97%. It doesn't get any better for people with hepatitis C, with an oral drug giving highest cure rates ever and fewer side effects.